Hello everyone, welcome to our channel. In this video, I'll be talking about myeloid neoplasms of the WBCs and in detail about the acute myeloid leukemia or otherwise called the AML. This topic is very important as many MCQs, long answers and short answers are frequently asked. So without wasting any time, let's quickly move on to the topic myeloid neoplasm. So basically, myeloneoplasms are the group of disorders that involve increased proliferation of the myeloid series of the leukocytes. So the cell of origin in the myeloid neoplasms are the pluripotent hematopoietic stem cells. So any mutations that occur in the hematopoietic stem cells will lead to an increased proliferation of the myeloid series resulting in myeloid neoplasm. So before moving into the classification of the myeloid neoplasm, we'll see a short note on myeloid versus lymphoid neoplasm. So as I have already mentioned, the cell of origin in the myeloid neoplasm is the pluripotent hematopoietic stem cells, whereas in lymphoid neoplasm, it arises from the peripheral lymphocytes such as B cells, T cells, and the natural killer cells. And the bone marrow in myeloneoplasms are more likely involved, whereas in lymphoid neoplasms they are less likely or never involved. Then the peripheral blood picture in the myeloneoplasm shows increased number of granulocytes such as neutrophils, eosinophils and basophils, and also their precursor cells such as myeloblast, monoblast, erythroblast, etc. Whereas in lymphoneoplasm, the peripheral blood picture shows an increased number of mature lymphocytes such as small lymphocyte and large lymphocytes and the immature cells such as lymphoblast. And in myeloid neoplasm, the myeloid series are involved, which includes the erythroblast, megakaryoblast, monoblast, and the myeloblast. Whereas in lymphoid neoplasm, only the lymphoid series are involved, which gives rise to the small lymphocytes and the large lymphocytes. So now let's move on to the classification of the myeloid neoplasm. The myeloid neoplasm is broadly classified into three groups. The one is the acute myeloid leukemia, the second one is the myelodysplastic syndrome, and the third one is the myeloproliferative disorders. And the myeloproliferative disorders comprises of CML, otherwise called chronic myeloid leukemia, the polycythemia vera, essential thrombocytopenia, and primary myelofibrosis. And an important point here to note is that both the myelodysplastic syndrome and the myeloproliferative syndrome transforms into the acute myeloid leukemia in its later stage. Before moving on further, we should be clear about two different terms. One is the differentiation and the other is the maturation. So the differentiation refers to the formation of immature progenitor cells and the blast cells from the stem cells, whereas the maturation refers to formation of mature blood cells from the immature blast cells. So in this picture, you can appreciate that the differentiation refers to the formation of erythroblast, myeloblast and lymphoblast from the hematopoietic stem cells, whereas the maturation refers to formation of mature blood cells such as red blood cells, white blood cells and platelets from the respective blast cells. So with this knowledge, let's move on further and see the definition of the each of the disorders. So AML, it refers to a defect in differentiation which leads to accumulation of the immature progenitor cells in the blood. The myelodysplastic syndrome refers to defect in maturation leading to increased production of myeloid series, finally resulting in ineffective erythropoiesis. And the third, myeloproliferative syndrome, it is a defect in proliferation which leads to an increased production of one or more terminally differentiated myeloid elements. So the AML is defect in differentiation, the myelodysplastic syndrome is defect in maturation, and the myeloproliferative syndrome is defect in proliferation. So you guys will be confused between the myelodysplastic syndrome and the AML. So to remember it in an easier manner, you just remember M for M. So myelodysplastic syndrome for maturation and AML for differentiation, and for myeloproliferative syndrome, as the name suggests, it results in increased proliferation of the myeloid elements. Now let's see acute myeloid leukemia in detail under the topics such as classification, pathogenesis, morphology, clinical features, and a short note on treatment. Moving on to classification. So in pathology, with regards to any of the cancer, you guys should always be confined to the WHO classification of the cancer. So the WHO classification of the acute myeloid leukemia is grouped into four. The one is AML with genetic aberrations. The second one, AML with MDS-like features. The third one, AML with therapy related. And the fourth one, AML not otherwise specified, or the French American British classification. First, let's see AML with genetic aberrations. So, three genetic abnormalities are associated with acute myeloid leukemia. The one is the translocation between the chromosomes 8 and 21, which results in fusion of the RUNX1 and RUNX-T1 genes. So translocation between 8 and 21 results in fusion of RUNX and RUNX-T1 genes. Translocation between 15 and 17 results in fusion of the RARA and PML genes, whereas inversion of the chromosome 16 results in fusion of the CBFB and the MYH fusion gene. So, point here to notice that the translocation 821 is associated with M2 type of the AML, whereas the translocation between the 1517 is associated with the M3 type of the AML, and the inversion 16 is associated with the M4 type of the AML. Next, moving on to the second group, AML with MDS-like features. In this group, in addition to the immature myeloid lineage, other immature cells of other lineages are also present. And the third group is the AML therapy related. In this, following any chemotherapy with drugs like alkylating agents and radiations will lead to the acute myeloid leukemia, and majority of the AML with this group develops from the secondary myelodysplastic syndrome. And the last group, AML not otherwise specified, or the French American British classification. So in this, they have grouped it into 7 major groups, M0 to M7, and here you should note that M3 is not present as it was recently removed from this classification. So the M0 to M7 denotes M0 is AML without differentiation, AM1 is AML without maturation, M2 is AML with myelocytic maturation, M4 is AML with myelo and monocytic maturation, M5 is AML with monocytic maturation, M6 is AML with erythroid maturation, and M7 is AML with megakaryocytic maturation. So by seeing this, you guys will be get confused and you will find difficulty in remembering this. So to remember it in an easier manner, let's put this into a flowchart. So we all are familiar with the hematopoiesis flowchart. In that, the hematopoietic stem cells develops into two series. One is the myeloid series and the other is the lymphoid series. Now we will be concerning only on to the myeloid series. So in myeloid series, the hematopoietic stem cells differentiates into four groups: the one myeloblast, monoblast, the erythroblast, and finally the megakaryoblast. And the myeloblast further maturates into promyelocytes, finally giving rise to the granulocytes such as neutrophils, eosinophils, and basophils. Whereas monoblast maturates into the monocytes, erythroblast maturates into the erythrocytes, and megakaryoblast maturates into the platelets. So with regards to this, I have mentioned the types of the AML in the green color. So M0 denotes the AML without maturation. So arrest here leads to the M0 type, and M1 is AML without maturation. So arrest here results in AML without maturation, and M2 is AML with myelocytic maturation. So arrest in this stage will lead to the M2, and M3 is AML with promyelocytic maturation. So arrest in this stage will lead to the accumulation of promyelocytes resulting in M3 type, and M4 denotes both the myelocytic and monocytic maturation, whereas M5 denotes the monocytic maturation, M6 denotes AML with erythrocytic maturation, and M7 denotes AML with megakaryocytic maturation. Here, you guys should never change the sequence of this blast, as if you change the sequence, the classification might go wrong. So you should be remembering it in sequence like myeloblast, monoblast, erythroblast, and megakaryoblast. Next, moving on to the morphology of the acute myeloid leukemia. So in hematology, we should be describing the morphology under two topics. The one is bone marrow picture and the other is peripheral blood picture. So in acute myeloid leukemia, the bone marrow picture shows characteristic of three blast cells, such as one is myeloblast, the other one is monoblast, and the another one is the abnormal promyelocytes. So first let's see the morphology of the myeloblast. So with regards to the hematology, whenever we are describing a cell size, we always compare it with that of the size of a small lymphocyte. So myeloblasts are 3 to 5 times larger than the small lymphocytes, with scanty to moderate cytoplasm and prominent 2 to 3 nucleoli. And the cytoplasm shows characteristic fine azurophilic granules, and these azurophilic granules clump to form a needle-like granules called the R rods. So I have attached a picture here. Let's see this. The cell is larger, 3 to 5 times larger than the small lymphocyte, and the cytoplasm is scanty to moderate, and the nucleus shows prominent 2 to 3 nucleoli, and the cytoplasm shows fine azurophilic granules which are clumped to form needle-like granules called the R rods. Okay. Next, before moving on further, let's see difference between myeloblast and lymphoblast. So myeloblast are 3 to 5 times larger than the small lymphocytes, whereas lymphoblasts are only 2 to 3 times larger than that of the small lymphocytes. And myeloblast shows moderate to scanty cytoplasm, whereas lymphoblast shows scanty cytoplasm. And the nucleoli are prominent in myeloblast, whereas they are inconspicuous and only one or two in number in lymphoblast. So in myeloblast, as I have already mentioned, it shows the fine azurophilic granules in the cytoplasm, and whereas in lymphoblast, as we all know, lymphocytes are agranulocytes, they show absence of granules in their cytoplasm. Next, with regards to the stain, we have three specific stains. The first one is the MPO or the myeloperoxidase stain. The second one is the Sudan black stain, and the third one is PAS, or otherwise called the periodic acid shift stain. So the myeloperoxidase stain is positive in myeloblast. We all know that myeloblast transforms into the granulocytes such as neutrophils, eosinophils, and basophils, and these granules contain a specific enzyme called the myeloperoxidase. So that myeloblasts are positive for myeloperoxidase enzyme, whereas lymphoblasts lack granules, hence they are negative for myeloperoxidase enzyme. Then the Sudan black is positive for myeloblast, whereas they are negative for lymphoblast, and periodic acid shift stain is negative for myeloblast and they are positive for lymphoblast. Next, a specific stain called non-specific esterase specifically stains the cytoplasm of the monoblast. So they are positive for the myeloblast. You all know that monoblast transforms into monocytes. Then the lymphoblast shows negative for the non-specific esterase. So finally, the myeloblasts are only positive for myeloperoxidase, periodic acid shift, and non-specific esterase, whereas lymphoblasts are positive only for the periodic acid shift stain. Next, moving on to the morphology of the monoblast. The monoblasts are large cells with characteristic folded or lobulated nuclei resembling to that of an kidney-shaped bean, and the cytoplasm does not show any granules. And with regards to the morphology of the promyelocytes, they are almost similar to that of the myeloblast, and the cytoplasm shows bundles of R rods called fagot cells. Let's see the picture of the three cells. So first one is the myeloblast. As you can see here, the myeloblast has very large cell size, which is of 3 to 5 times larger than that of the lymphocytes, and the cytoplasm is scanty and shows presence of characteristic R rods, whereas the monoblasts are also large cells with folded or intended nucleus, and the abnormal promyelocyte shows bundles of R rods called the fagot cells. Next, morphology of the peripheral blood picture. The peripheral smear shows an increased number of blast cells which are usually greater than that of the 1 lakh cells per cubic millimeter. Whereas some patient may also present with a count less than 10,000 cells per cubic millimeter. And here you should note that there is a condition called aleukemic leukemia in which patients may occasionally present with total absence of blast cells in the peripheral blood. So the patients with AML can either present with a myeloblast of greater than 1 lakh cells per cubic millimeter or may even present with total absence of blood cells, blast cells in the peripheral blood. Next, morphology with respect to the specific types of the acute myeloid leukemia. The M2, which is nothing but the AML with myelocytic maturation, shows myeloblast, which shows presence of fine acidophilic granules and rods, as you can appreciate in this picture. Then the M3 AML with promyelocytic maturation shows presence of abnormal promyelocytes, which shows presence of bundles of rods in the cytoplasm, which are also called the Faggot cells, as you can appreciate here. Then the M5 or the AML with monocytic maturation shows presence of monoblast, which shows presence of the lobulated or the intended nucleus resembling to that of an kidney. Then the M4 or the AML with myelomonocytic maturation, as the name suggests, shows presence of both the myeloblast and the monoblast. Whereas M6 with erythroid maturation shows presence of both erythroblast and some of the myeloblast. And the M7 AML with megakaryocytic differentiation shows presence of the megakaryoblast cells. Next, let's see some specific features associated with the AML. So the M3 or the AML with promyelocytic maturation is associated with a dreadful condition called the disseminated intravascular coagulation, or otherwise called the DIC. Next, the AM7 or the AML with megakaryocytic maturation is associated with Down syndrome in children. Then the M1, M2 and M3 type of the AML is associated with chloroma, which is otherwise called the myeloblast or the myeloid sarcoma, which are nothing but the extramedullary accumulation of the blast cells. Next, the diagnosis of AML can be done by staining procedure of the peripheral blood smear or via the flow cytometry. So staining of the myeloblasts are positive for the myeloperoxidase enzyme, Sudan black and non-specific esterase, as I have already mentioned. Then the flow cytometry result shows the myeloblasts which are positive for the markers such as CD33 and CD34. With regards to the clinical features in acute myeloid leukemia, the acute myeloid leukemia can occur at all stages, but they are most common at the ages of 60. And the characteristic clinical finding is decreased count of all the three blood cells such as the RBCs, WBCs and the platelets, resulting in anemia, neutropenia and thrombocytopenia. So anemia is of normocytic normochromic, neutropenia results in recurrent infections, and thrombocytopenia results in petechiae and the characteristic feature with respect to AML is the gingival hyperplasia and the gum bleeding. And the next is the chloroma. As I have already mentioned, it is associated with the M1, M2 and M3 type of the AML, which are nothing but the extramedullary accumulation of the blast cells. And here in this picture, you can appreciate the gum hypertrophy and the gum bleeding. And this is the clinical picture of the chloroma, which is nothing but the extramedullary accumulation of the myeloblast cells. Next, with regards to prognosis of the acute myeloid leukemia, the acute myeloid leukemia associated with therapy has very poor prognosis, whereas AML with promyelocytic differentiation has very favorable prognosis. So summarizing on the topic, the myeloid neoplasms are broadly divided into three major groups. The one is acute myeloid leukemia, the second one is the myelodysplastic syndrome, and the third one is the myeloproliferative disorders, which further comprises of chronic myeloid leukemia, polycythemia vera, essential thrombocytopenia, and primary myelofibrosis. With regards to the definition of each of the disorders, AML is the defect in differentiation, myelodysplastic syndrome is the defect in maturation, which is M for M, and myeloproliferative syndrome is the defect in proliferation. Next, with regards to the classification of AML, it is broadly divided into four groups: the AML with genetic aberration, AML associated with therapy, AML with MDS-like features, and finally AML not otherwise specified, which is further classified into seven major groups: M0 to M7. M0 is without differentiation, M1 is without maturation, M2 is with myelocytic maturation, M3 is with promyelocytic maturation, M4 is with both myelocytic and monocytic maturation, M5 is with monocytic maturation, M6 is with erythrocytic maturation, and M7 is with megakaryocytic maturation. So with this, we next move on to the morphology of the AML. It shows presence of three characteristic cells: the myeloblast, the monoblast, and the abnormal promyelocyte. So the myeloblast shows presence of R rods in its cytoplasm, the monoblast shows folded or the intended nucleus, and the abnormal promyelocyte shows bundle of R rods called the fagot cells. So with this, we end the topic, and thank you guys for listening to this session. And if you guys have any doubts or queries regarding to the topic, do mention them in the comment section, or you can also reach us at our Gmail medimentorz@gmail.com. If you like the lecture, do show your love by liking the video and subscribing to our channel MediMentorz, and do share with your lovable batchmates. Thank you.